Okay, I just want to welcome you to our final of webinar for COS, Community Opioid Symposium of 2025. We are doing a panel, and the panel is Real Voices, Youth Addiction, Recovery, and Resilience, a panel discussion. And our panelists today are Dr. Bagley, Riley McCann, and Dr. Craig Comanche. And this is a free educational event brought to you by Northeast Delta Human Services Authority and the Louisiana Department of Health and Office of Behavioral Health and Foundation for Wellness. It is accredited for 1 hour for AMA PR Category 1 credits, ADRA, social worker, general credits, and LPC. As for the financial disclosures, you receive that information in your email right before the event. Dr. Bagley is a consultant to the Startup Playbook and is creating a curriculum to address cannabis use in schools. This relationship was disclosed and has been mitigated through peer review process conducted by our committee at Foundation for Wellness. The remaining speakers and all members of the planning committee have no financial disclosures. Okay, I'm going to do a little bit of brief bio for our speakers. And then I'm going to turn over the floor to everybody. Dr. Bagley is an associate professor of medicine and pediatrics, director of the Youth Advocacy and Research Collaborative, and associate program director of the Graykin Fellowship in Addiction Medicine at Boston University at Chobanian and Avedisian School of Medicine and Boston Medical Center. She is the founder of Catalyst at Boston Medical Center, a multidisciplinary program that provides integrated substance use care and primary care for youth. Riley McCann is the administrator of Second Chances Recovery Center in Rayville, Louisiana. She holds a degree in psychology from Louisiana Tech University and is currently pursuing her executive MBA. Dr. Comanche, who will be joining us shortly, is a certified addictions counselor and a certified clinical supervisor, a recognized peer support specialist supervisor for the state of Louisiana, and a licensed master life coach. He is also the owner of REMA Leadership Institute. Okay, so this is a panel. We have the planning committee prepared questions that we're going to kick off discussion with our panelists, but we want to encourage everyone in the audience to ask your questions. There is a Q&A feature at the bottom of your screen. Please be sure to utilize that to ask your questions, and we'll be monitoring it throughout the whole session. So I'm going to kick it over to Kara and Jamie to kind of start facilitating the questions for Riley and Dr. Badgley right now.
All right. Thank you, everyone, for joining us. We're so excited that you're here with us for our final webinar series for Real Voices, Youth Addiction, Recovery, and Resilience, a panel discussion. So we're going to be very real and open and talk about some issues that affect youth and should they come in contact with substances, whether it be drugs or alcohol. We want to provide information and just education on, how to handle that topic. One of the words that you notice that we used is resilience, and that's because we believe if you equip children with the tools that they need, they are resilient and can persevere, and make it through any issues and things that they're having. However, we have to have open and honest dialogue with them and should not, the way that things are currently going in our society, this is no time for us to be cookie cutter or trying to, make everything just always pretty. We have to have open and honest dialogue. And so that's what these questions in this discussion will be about today. So we're going to kick it off first. The first question will be, and the way that I'll ask it, I may ask one of the panelists. However, anyone can answer at any time with any feedback that they have. But Riley, what are some early warning signs of substance abuse in teens?
Yeah, so early warning signs in teens can often look the same as in adults, but obviously with teens, you are seeing them day in and day out. So you're going to see isolation begin, change in friend groups, which that can be one of the earliest warning signs that comes on is a sudden change in friend groups. You're going to see change in eating habits, change in sleeping habits. That is a big one to pay attention to. Most of the time with kids, you are going to see them sleeping more often than not. Sometimes it can go the opposite way, staying up later at night, but most of the time we see sleeping more. And you're going to see just a change in demeanor and attitude that comes along with the isolating, more regression. There can be things at school that start to regress as well. So yeah, those are some of the top things that we see happen.
Okay. Dr. Bagley, is there anything you want to add to that?
No, I mean, I think I just a couple of thoughts, but it's really just to, like expand on what Riley said. I think a lot of like those changes in like mood and sleep and like what's happening in school and with peers um can be signs. I think it's what can be challenging, and I think we're going to get there eventually in this discussion, is like those can also be signs of other things, like sort of
Mhm.
emergence of mental health disorders or bullying at school or online, or and so it can be sometimes hard to know like what is the thing that's happening. And so that's part of the reason why we're here, in terms of thinking about like who are the resources and other people that parents or families, caregivers can reach out to help sort that out, because that can be hard to do as a parent, or as a teacher, or sort of someone who's invested in a youth, because it can look sort of like lots of things until you sort of dive in and sort of understand more of what's happening with the teen.
Yes. Okay, great. Dr. Comanche, thank you for joining us and being with us on today. We actually had just gotten started. So we've actually just gotten started with our first questions, and we were just talking about what are some early warning signs of substance abuse in teens.
Oh, good morning. Good morning. I would say that, declining grades, that would be something to pay attention to. Um, a change of peers, like you notice that your son or your daughter, that they're hanging with a different group of peers.
Mhm.
Um, Isolation would be something that I would be paying a very close attention to. Um, and just overall withdrawal. Of course, you always gonna look at things like the eyes when they're coming in, like maybe from the football game or whatever. You want to pay attention to the eyes, making sure they're not bloodshot. Take those glasses off in my house. Those sunshades. That was one of my grandmother's main things. You don't wear no sunshades in here. I want to see your eyes. Certain weight changes, and just maybe becoming a little bit more irritable than normal.
Okay.
Any behavior changes that these things are just suddenly starting to happen, I would definitely start kind of paying attention to that. Just they're not acting their normal self. So
Okay.
that's something that I would be paying attention to.
Okay, great. Those were some great responses for that. So
Mhm.
that leads us to the next question, the next topic that I want to cover. And so anyone can chime in with this one. Why is it important to answer the tough questions about drugs and alcohol with your child? We talked about looking at the warning signs, but why is it important to answer those tough questions? Meaning when they come and ask you about it and ask you different things, whether they've seen it from peers or they've seen it on TV and in movies and TV shows. Why is it important to be able to answer? And when I say answer, answer truthfully.
I don't mind taking that one. So I think a big thing is if you do not, somebody else will.
Mhm.
And making sure that with you have been such a close person in your child's life for so long, and keeping that open, honest, and safe psychological space for them to have, not jumping directly into this form of shame, but keeping this open conversation, even when the tough conversations come around. Because if you do not, again, somebody else will, or social media will. They have so much more at their fingertips today to get answers for things. And it's just so important that they know you together can seek those answers out.
Yes. Anyone else want to answer that?
I love that answer. I think the other thing I was thinking about was that they kind of, teens, whether or not you remember being a teen or you take care of teens, like know how to sort of call it when someone's not being honest with them or sort of not giving a truthful, transparent answer. And so if we don't answer those tough questions truthfully and sort of either try to use a lot of fear or like say like, oh my gosh, this huge consequence is going to happen, and then like it doesn't happen and you like lose the credibility because the thing didn't happen, that's like a real risk. I'm definitely not suggesting that we're not really clear about what risks are or what consequences are, but they should be like accurate, because otherwise they kind of know how to call our BS, to be honest, and
Yeah.
so like that's what they do as teens. And so On the other hand, being honest and transparent and genuine and having those real conversations is like a way to build, credibility, trust, and rapport so that they know that they can come back to you and they can trust you because you're going to tell them sort of like what's really going on, what the risks are, how do I manage this like tough situation with friends. And we do that by, just being yourself and being genuine.
Yes. Okay, Dr. Comanche, anything you want to add before we move to the next question?
Yes, I think both answers, both what the lady shared was great. I just think we need to make sure that we're dealing with any myths. You know what I mean? Because that sometimes, there are myths out there, especially concerning marijuana use. That it makes me think better, or I can relax more, or I can, and so we need to share with them the dangers of these myths and their long-term effects that that these drugs have. Just because something is legal doesn't mean it's not going to have long-term effects. We talk about tobacco, we talk about alcohol, now THC. These things are legal, in some states, but they're going to have long-term effects. So we should make sure that that they are aware of that, and that we're just being absolutely honest. That just because it's legal for you to do something doesn't mean that it's not going to have detrimental effects in the long run as far as memory loss and just different things like that. And, we of course, we want to avoid scare tactics, trying to scare them and just be absolutely honest, though, about what the risks are, what I mean, pertaining to these substances and how, by the time they reach the age of 40, they'll have a change of mind concerning some of this stuff. So I just think being absolutely honest about this and being honest about our own lives as well, because you know what I mean? We're adults now. We it's not like we haven't been teenagers. It's not like we didn't sneak out the house. It's not like we didn't do this stuff. So we need to just be open and honest with them concerning these areas.
Yeah, that leads to a great point and takes us into our next question. When you said, how those drugs are now legal now, that used to be, once was, illegal, and in some way or another they're able to access them in a legal standpoint. So let's talk about why teenage experimentation is more dangerous now than it was in previous generations.
Yes. Well, I'll go ahead and answer that. Well, it's more dangerous because the potency of the marijuana. It's not like it was, it's not like it was back in 1983. You know what I mean? Like I'm 56 years old, and that stuff now, man, it's so loud. Like when you're in different cities, or you're in New Orleans, especially, which is one of our major cities here in the state of Louisiana, like you can smell that stuff a mile away, and I'm like, whoa, man. Like, so it's more potent than it is. And that means that these chemicals are affecting the brains of our children. You know what I mean? So that's something that we need to, the THC levels are higher, right? The possible fentanyl contamination concerning the pills and just different powders that lead to records, in overdose and adolescent brain development, right? It's not complete until they're in their mid-20s. So we're dealing with some stuff now that we really need to be educating them on and the harms and dangers of this stuff. And how that, like, over 70% of recent overdoses now involve fentanyl-laced substances, according to the CDC. So we need to make sure that we're educating them on the latest trends concerning overdose, and especially how this fentanyl, they're putting it in marijuana. They're putting it in pills now. If people are buying pill presses now, this is affecting everybody. So we need to make sure that we're educating him. And this is why experimentation now is more dangerous than it's ever been.
Okay, thank you for that.
Yeah.
Does any of our other panelists want to add to that?
Yeah, I want to say too, when people are outside, I think sometimes I take this for granted. I am in the world of addiction, right? And recovery 24/7. So I'm hearing so much that you touched on, Cara, about synthetic drug use.
Mhm.
People are not realizing how much in the residential treatment sphere we are getting intakes at a level now greater than ever for synthetic drug use, because gas stations are making this so easily available to pretty much all ages, let's be honest. And a lot of the marketing is made for younger generations as well. And when it gets promoted, it makes it seems like it is just this completely natural, innocent, it's going to help your pain relief. And there's not as much of a fear associated to it as there are a lot of drugs that we hear in mainstream media the most, right?
Mm-hmm.
And so it seems like harmless experimentation, but really the entire goal is to keep you coming back to buy more, right? Marketing 101. And so that in itself, it's geared towards addiction. And what also comes from that with the younger generation, what we're discussing today, is their brains are still developing. And so they're latching on to those dopamine surges at a higher rate and looking for that in a greater capacity than someone in the generation later, right? Social media adds to that today. They have access to quick fixes at a higher rate than any other generation has before. So that means they also need that dopamine surge at a greater rate than other generations have previously. So they're looking for those coping mechanisms now. And when we were discussing that earlier about the prevention, and I was listening to Sarah speak about the risk, right? Yes, they will still go and have those conversations with someone else, but I do want parents today to know the way that you respond and the demeanor that you carry for that first conversation a lot of times determine if the child feels safe coming back to you for more, and to bring that information that they got from other people to you and say, well, so and so said this, or well, social media said this. So yeah, those first conversations, being open about what is out there and parents educating themselves about these gas station drugs, that's so important.
Yes. Thank you. Thank you. I want to take our next question. I want to address this one to Dr. Bagley. Dr. Bagley, studies show that common risk factors for teens and substance use are family history, mental or behavioral health conditions, and peer pressure, among other things. How important is it to be aware of these risk factors and what can be done to help mitigate them?
Great. Thanks for that question. I mean, I guess I'll start by saying like that it's definitely important to understand those risk factors, right? Because they're risk factors, and so they are actually putting an individual youth sort of at sort of uh, they're more vulnerable. They're sort of at this heightened risk for potentially like using drugs, but then sort of continuing to use drugs and maybe even developing a substance use disorder. And so understanding that sort of helps provide sort of some background context for like how we might be working, with that youth. It's also important to remember that those risk factors aren't like determinative, like in that, like just because you have a risk factor does not mean that you are going to go on and to have a substance use disorder. And I think that's important because we want to make sure our youth have like have hope and like a growth mindset, or like sort of like this does not mean I am like destined to be maybe like someone else in my family who has a substance use disorder. I've met so many youth who feel like, of course this is what happened to me because that's what's happened to everyone, but like I think it can be part of our role to be like, no, like that is part of your history and story, and there are other ways that we can work together to sort of think about pro-social activities and finding other more positive ways or safer ways of coping than
Mm-hmm.
using drugs. I think that in terms of sort of mitigating those risk factors, I think one is just sort of circling back to these like open, honest conversations that we're having with them. And I think sort of, as Riley, you were just saying, sort of like being as a parent or caregiver, someone who your kid can come talk to. Like that's a really important thing. I think thinking about, identifying, addressing mental health disorders early on is also really important. Like behaviors make sense. Kids may decide to try substances and then continue to use substances because it's providing some kind of relief for sort of maybe undiagnosed or sort of untreated or undertreated mental health disorder. And so I do think that if we are able to sort of engage those youth in treatment and address those symptoms and teach them other ways to sort of treat to have relief from sadness or worry, or maybe they've experienced trauma, or have ADHD, like that's also like a really important way that we can also mitigate those factors. And then, I think in terms of peer pressure, it's also having these open conversations about like, well, what are we going to do? Is it maybe with the parent role playing is hard, but maybe that's happening in school or with other kinds of, I have kids, my kids would like never role play with me. So I think that's what I'm imagining right now. but they can do it with other people. And so like how would we, what would you do in these situations? Like who could you talk to? Who are some of the peers that are maybe not using drugs, or you could, so I think those are the ways. So I think it's all about this like early intervention, having these conversations earlier and really trying to get ahead of it. And then knowing that if use does start to happen, there are still things we have. We have really good treatment. There are ways that we can take care of you. So if this does happen, like how do we make sure we're trying to also eliminate sort of all the guilt and shame that can come along with using drugs or having a substance use disorder or being engaged in treatment. And again, I think all it's like the open communication and transparency and compassion and being real too, though, about the risk factors as we've talked about too.
Yes, I agree with that. Does either of our other panelists want to add to anything Dr. Bagley shared?
Yes, I would like to just say that uh, I wholeheartedly agree with that open dialogue. I just, yeah, I'm more so being a person that 14 years of recovery myself, right? Prior substance use issues, of course, being a child, being a teenager, right, and just working with this demographic on a daily basis. Like I am more convinced as I do this on a daily basis. I'm more convinced that we really should be asking the question of why are you hurting? Why are you in trouble? Tell me how you're feeling. Because the drugs are simply that's the top coat. There's an underlying factor. Like so using substances is a direct indication that someone is in pain. Where are they in pain at? Like, okay, so whether it's disassociation, whether it's the incongruent self, no matter what it is, it's something going on the inside where someone is seeking relief. And so if we have a teenager that's indulgent, I think if we can identify that early on and really have these open and honest conversations about where the pain is. What are you upset about? Why are you hurting concerning this? Tell me how you really feel rather than just focusing on the substance use, because if we can deal with these core issues, I think we can kind of nip this stuff in the bud and keep somebody from getting into this cycle of addiction that's going to last 20, 30 years. And so that's kind of where I am on it. I'm kind of like, just as far as professionally, like I'm on a digging tour. Like I want to know why are you in pain? Where are you hurting it? What's this really about? Rather than just so much concentrating on the adverse consequences of the use. So I just wanted to kind of just throw that out there because I think that's so important. Thank you.
Okay.
Thank you.
Jamie, you have something you want to add?
So yeah, we have a few questions in the chat, and wanted to ask one specifically because you guys are speaking about behaviors, and one of the questions is, how can you get to the source of a behavior change with your teen without them feeling threatened or defensive?
Well, I would say that that we should work, especially as parents, to create a safe environment, right? A safe environment where no one is going to talk to anybody if they don't feel safe. If they don't feel safe, and if they're going to feel like they're going to be judged, right, or condemned, they aren't going to open up. That's a child or anybody else, right? I've watched a few different studies or videos pertaining to these questions. That's a very good question you ask, and it's like if I don't feel safe, if I don't have anybody to talk to, then what's going to happen is I'm going to internalize this that I'm dealing with, and I'm going to solve it with a behavior that gives me some relief, right? So whatever behavior I can do that's going to give me some relief to how I'm feeling, right? Then that's the behavior I'm going to do, right? And if that happens to be drugs, if that happens to be sex, if it happens to be whatever it happens to be, if I don't have anyone to talk to about it, then that's how it's going to be solved. So I would say that we have to, as parents and professionals, we have to relax the standard here a little bit and make sure that we have created an environment where our children aren't going to feel like they're going to be judged. They aren't going to be condemned. They are going to be talked about. And as soon as my child come in and tell me something, I'm not going to get on the phone and call Auntie Susie, and she's going to hear me in there on the phone talking to my brother about what she just said. See, this is the kind of stuff that's been going on in families, which is the reason why children don't open up about a lot of things that they're going through, because mama gonna get on the phone and call grandmama, and grandmama gonna call auntie, and so this the kind of stuff that we've been dealing with. So I think just creating a safe environment is going to be really important.
I want to add to, so great, Dr. Comanche. I want to add to parents accepting you may not always be the safe person for your child, no matter how safe of an environment you have created. That's so important, recognizing that they may have connections in their life that they feel like they would disappoint less than you, right? It could just be something in their head that creates that block between you guys and nothing that you've done. And so humbling ourselves enough as parents to recognize I don't always have to know exactly what is going on, as long as I know that they have a safe person they are speaking to, whether that's counseling, whether that's an aunt, an uncle, a friend that is in you guys' life that you have always noticed. You know, I can think of so many families where that is a great example, but trusting that, okay, as long as I can see that behavior changing, then maybe they'll come to me when they're ready, and give that dialogue to them as well. But not pestering the person they're speaking to speak to you about it also is very important.
Yes. Oh, yes, Riley. That is and I know I'm just serving as moderator, but that's a great point. I experienced that. So I wanted to share that for if there's any parents there, that I did experience that with my oldest child. And it was hard and difficult to deal with. And initially I didn't handle it the right way. And what you said, like pestering and trying to ask and find out, because I felt like my role, I'm mom, I'm supposed to be doing the problem solving. And I had to realize, and it did take, honestly, it took an honest discussion. And that was what my daughter said, was that one of the things was that she didn't want to disappoint me. And
Yeah.
before she came to me with it, she wanted to kind of already had a solution worked out and figured out of how, like, okay, mom, I'm letting you know this is what I've done. But also on the other hand, this is what I've done to start reconciling and solving that. So just sharing it to say, when you said that, it took me there, because everything you pointed out, I saw that, I experienced that, and it was very difficult. But once I let go and trusted that the person that she was talking to was going to guide her where needed and when needed, and would call me if needed, then we were able to get to a resolution and resolve that situation way faster than we were with me constantly trying to butt in and take over. So thank you for that. We have a couple of
Thank
other
you.
questions. Jamie, did you want to take another question from the Q&A?
Uh, yeah, I can do that. There are a couple that I will be able to answer, without having to ask. But we did have another question. What does it look like to support your team in their efforts to quit smoking marijuana or tobacco vaping, specifically if they are refusing to engage in an outside addiction support?
Anyone want to take that?
Yeah, okay. So
Okay.
indeed it's for me, right? So what does it look like? It looks like a lot of patience, right? It looks like a lot of patience, and because I mean, we're professionals on here. We understand client-centered, therapy, client-centered treatment, right? And you have to just really go at that person's pace, right? And so when they don't want to engage in the traditional treatment, model, whether it's outpatient or inpatient, for a lot of reasons, because our team don't want to wear that badge of shame or that mantle of shame, having known that they're going back before their peers, right? And they've been to treatment, or so they don't want to wear that. They're just trying to quit on their own, or whatever methods they choose. I just think there should be some support. Like whatever they're choosing, we support, we do the best we can, be patient with them. And I'm going to throw this in, and a lot of prayer, right? And a lot of prayer for strength. that we're being supported the best way we can, and kind of just putting information out there and letting them choose. It's kind of like helping remove the stigma. There's so much stigma attached to addiction that's negative, right? And it only focuses on the drugs and alcohol. And you and I, we all know that there are many forms of addiction. So we just want to educate, and we want to be patient. We want to pray, and we want to support them. And, in whatever measure, whatever method they're choosing to try to, stop the tobacco use, the alcohol use, or the marijuana use, because there's no one size fits all answer here.
I will add parents educating yourselves as well. Obviously, this panel is such a great discussion today and such a good opening, but I would suggest that any parents that are out there watching this know the resources in your area. Google is a great resource today. I will say that for finding meetings, finding support groups. I know in our area in particular, we're not as big. And so, but we do have a lot of Al-Anon. Some people are scared to go to Al-Anon meetings. Those are support groups for family members that are dealing with a loved one in addiction. And sometimes people are scared to go because they may think, oh, well, my child's not that bad off. My husband's not that bad off. It's for you. It's not about the severity of their disease. And a lot of support groups are the same way. They're speaking to you about you and helping guiding you with the same questions that are being asked today. Mm-hmm. And I think getting that on a regular basis, knowing that there's more people out there, you would be surprised how much familiarity would be in the room.
Right.
Dr. Bagley, we have another question that has been submitted that I'd like to pose to you. It says, because many early symptoms of drug use can resemble common mental health challenges or even typical behaviors such as those seen in avid video gaming, how can we educate parents to recognize the difference and screen for early warning signs without losing credibility with making assumptions?
That's a great question. I think the advice that I give to parents is to be aware of these different warning signs, but that actually, if you recognize them, to try to figure out who is the professional in your child's life who you're going to go to help sort it out. Because I think as a parent, it may be really hard, and that what you don't want to do is sort of start to blur the line of becoming the therapist or the physician or the psychologist or the community health, or like whatever the professional role is of the person who could sort of be sussing this out. Like, you don't want to become that as a parent. You want to sort of maintain that role as of being a parent. And so I think when I am thinking about talking to parents who are starting to notice these behaviors or notice things that they're concerned about, really thinking about, okay, I'm going to have this conversation with my kid. I'm worried about it. I wrote this down. I'm going to plan out when I'm going to have this conversation so that I'm not being reactive in the moment because something just happened and I'm like, something just happened. And now I'm like, right, like really easy. It's very easy for me to imagine doing that as a parent, but like it's that discipline. Figuring out what you want to say and really sort of thinking like you're trying to not accuse your kid of any specific behavior, which I think this question, that's what this is all about. You're not trying to sort of like jump to assumptions, but you're saying like, gosh, I've noticed these changes. It's like, I'm going to use I statements. I'm going to like just notice like behaviors. I'm sort of going to try to not make assumptions or use accusatory language. I'm here to talk to you about it if you want to talk to me about it, but I also recognize like maybe it's not comfortable to talk to me. And so that's cool. I want, let's either sort of think together who we can go talk to, or we're going to call, maybe there's a school counselor, or maybe there's like a pediatrician, or there's someone that trusted adult who that they could sort of go talk to and sort of be able to start to figure out what's going on. I think the other thing to sort of, as I'm thinking about a question like this, is it's not, I never say never. It's going to be uncommon that you're going to figure it all out in one conversation. So even if you have a teen who's ready to go talk to, again, I'm pediatric, like talk to their pediatrician or talk to a school counselor or talk to a therapist that they've been seeing about what's going on, unlikely it's all going to be revealed in one visit. right? So it's like us also having patience about, we're going to start to hear this story. There's going to be maybe ambivalence. They're trying to figure out if they can trust the adult they're going to talk to there, and sort of giving them that space. And it doesn't mean that they're manipulating or lying, or it's just like, it's hard as a teenager to be like, to be trusting of adults. Or
Yeah,
and like that's actually like really
yeah,
normal behavior.
yeah.
Like, so
Right.
that's
Yeah.
okay, you know. And so I think also sort of taking it step by step. I mean, that being said, there are like real risks, like we've been talking about fentanyl and overdose. Like there's like another conversation around safety that is a little bit different, in terms of making sure families know how to respond to emergencies. But in general, I think sort of realizing these things, sort of taking our time, not delaying, dragging our feet, but taking our time is actually okay, and actually might lead to the better outcomes in terms of engagement with the teen, being
Mhm.
willing to talk about what's going on.
Great, thank you. We had another question. We're gonna make sure we answer those that have been submitted to us. Um, Riley, I'll let you start with this one, and then anyone else, if they want to add to it, they can. Is there a way to ask why without asking why? Because this question is a trigger to a lot of youth I've worked with over the years. They get tired of hearing me say, "Tell me about," to circumvent the why question.
Yeah.
Mm.
So I just know early on, a little bit of my background too. I grew up in addiction treatment quite literally my entire life. So I think my background, I was hearing these things asked a lot to other people, if that makes sense. And I remember I had an older brother, so I remember watching him go through things and listening there. And one of the earliest conversations that I was taught in addiction recovery was just stop asking why altogether, but ask what, what is going on? What I really think starting back dialogue with teenagers that doesn't jump right into that, like, how was your day today?
Mm-hmm.
You're not immediately going to the why. I think a lot of what Dr. Bagley was touching on is we really are not those people most of the time. I even say that to the adults and the family members that come through here. They need to go somewhere else to more than likely get the help, because those lines, as much as you try to blur them, they don't blur. And there's always this area of, I don't want to disappoint you, or you're too emotionally triggered by nearly everything that I say. And so it's really hard to have that conversation without scaring you that this is 10 times worse than it actually is. I think as parents too, we're always seeing the worst in that. But yeah, I think what's going on? How was your day? That's like a great place to start, really.
Mhm. Yeah. Pick up on some other cues that'll lead you to
Yeah, you've
getting
really
to
got to
that.
be listening and paying attention. And sometimes they've told you before you recognized
Yes.
the symptoms start to show up. You just weren't listening well enough.
Yeah.
So kind of going back.
Right.
Okay. Anybody else want to add to that before we go to the next one? Okay.
I
So
oh
go ahead. No, go ahead,
sorry.
Dr. Bagley. I'm sorry.
I ask, I mean, this is like very simple. I hear you that like the why feels super confrontational. I mean, once I've established, so I work in a primary care setting, but I do intakes with our social worker so that we try to minimize the number of questions we're asking people, because they're so, I know
Repetitive.
it's like intense, right? And so it's like we're trying to, so we go back and forth. And so we ask a lot of questions. We like thank them for being there and sort of acknowledge that it's hard, that they don't really know us yet. So we're going to be sort of trying to minimize the questions by doing it together. And then we'll ask questions about, like, sort of tell us about, asking questions about what their goals are, why they're there, why do they think they're there. And sometimes it's like different than why like their parents think they're there. Um, and then we like, tell us about your drug use, like tell us about the things that, what do you like about like weed, why are you like, what's the benefit, like what are you getting out of it. And I think we're really careful, we don't want to I think we feel like there's a way to have that conversation where we're not encouraging or condoning use, or but sort of trying to get at the motivation that we've been talking about, I think almost this whole hour, of like that why, because the why helps us then figure out what's going to be the best advice that we can offer in terms of treatment to address the underlying stuff that might be going on. you know, because it's going to be different if there was a major trauma versus like depression versus anxiety. Like the things are going to be different. And so understanding where's the benefit helps us figure out what are the other kinds of activities or coping or treatment or whatever it is that could replace that, you know, provide a similar benefit. We have to make it better to like not use drugs. Like that's sort of how I see my job. It's like I have to sort of like be working with them to come up with like better options and safer options.
Okay. Thank you for that. That leads to our next question that we have. I want to try to make sure we get all of the questions that are submitted to us, and then we'll go back to some of the ones that we already had if we have time. So Dr. Comanche, we'll start with you, and then we'll go to anyone else that want to add. This kind of leads off of what Dr. Bagley was just kind of saying. Addictions are coping mechanisms for their negative feelings about themselves, in my experience. So, what other coping mechanisms can you teach children to use instead of the addictive behavior?
Okay, let me turn my mic. So, breathing exercises, exercise. I'm talking about physical exercise, sports, different sports activities. They love electronics, right? Certain type of games that stimulate, their mind or their brain that allows them to think. There are numerous. Just gave you a few that other type of things that we can do with our children or programs we can put our children in to help them be able to cope with, whatever may have led to that behavior. But I just kind of want to go back though to what Dr. Bagley said and Riley, but those conversations are going to be so very, very important because we can push them towards using another coping skill like a breathing exercise or playing, or dance if it's for a girl, or cheerleading or basketball or football or church choir or Bible study groups. We can encourage all of these positive behaviors and activities that we want to. But if those core issues there, if there's been trauma there and those core issues are not dealt with, right, those other behaviors are going to only be temporary because there's pain somewhere. So it has to be alleviated. It's going to have to be dealt with, right? And I think, let me just say this. I think that setting goals to helping them try to grow and to determine what it is that they want to do with their lives. Now, I think that is another vein that, that keeps a person focused and building momentum towards possibly college or career or, because sometimes people have the power to be able to push past trauma because they're so focused on something else, right? And I'm a firm believer that when it's time to deal with something, then God will put us in that position or allow that season to come where we have to deal with it. So a lot of times people just, push trauma and stuff to the side to focus on career goals. I would just say keeping them engaged in healthy activities, though, right, is something that we could do, but never underestimate why it got started in the first place. I think we should always be working to alleviate that, to get down to those core issues. Yeah.
Okay. Anyone else want to add to that? That was really good.
That's good. I agree with
Okay. All right. So we will go back to some of our other questions that we had. Let's talk about when is the best time to start talking about drugs and alcohol with children. You may have some parents that feel like my child is too young, or maybe you talking to them is going to expose them before they're actually exposed and don't want you doing, some of the preventative programming that, you may have. But when is a good time for us to start talking about drug and alcohol with children?
I would not mind speaking on this. I think a lot of times, first off, the answer is as early as possible. But that does not mean you're sitting there talking to a 5-year-old about marijuana right? I
Mm-hmm.
actually love listening to Dr. Comanche speak on safe medication practices. And that is one of the first conversations that can be had with as young as 4 or 5 years old. But it can go as simple as, hey, you do not take medicine from someone that is not a doctor or your mom and dad, right? Or your guardian, right? Those are little small. And then as children progress and age, these conversations become more age appropriate and they develop along with them.
Yes. Dr. Bagley, would you like to add to that?
No, I agree. I love the talking early and just sort of thinking about the sort of the frame of like wellness
Mhm.
early on and why we take medications and stuff, I think is really awesome. And it, I do think it's one of those things about whether or not we as, adults decide to have these conversations, like they're going to be exposed to it from like friends and social media and like other and TV and movies and those images are so present like really early. You think about, I don't know, people drinking glasses of wine even in like sitcoms or in movies to relax. Like those are images that even 7, 8, 9 year olds could be seeing. And so having those conversations early about like what are healthy ways to relax at the end of the day and what are, I think is appropriate, because otherwise they're only going to be getting the information about like, oh, this is how you relax at the end of the
Yeah.
day is you go home and or you go home and you smoke or you go and so I think giving them alternatives and sort of acknowledging that our information environment is like so wild these days. Like it's so
Yeah.
different.
Yeah.
um and so if we're not there, yeah, someone else will be or something else will be.
Yeah.
So
Yeah. And I think we also have to be honest with ourselves. A lot of times children can tell us way more than we probably think they can on the subject, even if it is not true. It can be, they can probably tell you 5 things that they know, and only one of the 5 is true. But you think about if they're believing I think it was Dr. Comanche or someone mentioned the myths, having to be aware of and knowing what's out there. If they're not, if you don't know what your child know, or aware of, or you're not making sure that they're presented with correct information, then we're creating a bigger problem to try to resolve later down the line. So that's something that we do see sometimes, not often, but we do have sometimes where there are parents that'll be like, well, no, I don't want my child to know about this subject or be introduced to the subject right now, thinking or feeling that they're too young. But like Riley said, Dr. Bagley said, there's so many different ways that you can do it without specifically saying this. And this is marijuana or this is that. And I think somebody mentioned what about drugs that look like candy? That's something that we have to be aware of too, and making sure that we tell our children, you don't take anything from anybody, regardless of what it looks like these days. I think Dr. Comanche mentioned pill presses in one of his previous responses, and knowing that, they can make anything look like whatever it is that they want it to look these days that can harm, and be very detrimental to our kids. So we want to be very cognizant of everyone's time. And so we are approaching the end of our hour. What I would like to do at the end of this hour is to allow each of the panelists to talk about, just to summarize this discussion that we've had and provide what recovery and resilience look like in youth addiction from your perspective to our attendees on today. And then if we have any other questions to come before we close, we'll try to get maybe 1 or 2 of those in. So Dr. Bagley, if you would like to provide us with some of your closing thoughts.
yeah. Okay. Well, this has just been a total pleasure, and it's really been fun to sort of have to have this discussion. I think the things that I'm reflecting on are, the importance of engagement. And so like approaching our youth with like curiosity and compassion and non-judgment in the conversations that we're having with them. And whether you're a parent or you're a professional taking care of them, that you don't necessarily necessarily have to be the one who fixes it, right? And it's not necessarily about fixing, but it's sort of about making sure that our youth sort of do have access to someone who that they can be taking care of, who can sort of talk to them. And then just this idea of behaviors making sense and sort of understanding that youth have complicated and sometimes sort of feelings, emotions, and it's their job to be sorting them out developmentally, like they're figuring out who they are. And so how we sort of understand what's driving them can really help us as the adults in their lives, sort of get them to the next stage. And so that's being curious and compassionate and non-judgmental, and honest about risks too. But this has been great fun, and happy to answer questions over email and stuff too, once this is all over.
Great. Thank you. Thank you. All right, Riley, your thoughts, final thoughts?
Yeah, I did want to say thank you as well. I've really enjoyed this today a lot and great to meet some of you. So the biggest takeaway for me from this, I was just thinking as everyone was speaking today, that if you are a newer parent or you have younger children, I think the biggest thing that you should take away from this experience is open dialogue is so important. But the framing of your response, your reaction is not just limited to the discussion of drugs and alcohol. From a young age, the way that we respond to children when they are quote unquote in trouble or have done something to possibly disappoint us, it really does start as young as that. If they start to feel later on in life like they can come to us with things that they are disappointed in themselves about. So our reactions. And now if you are a parent that you have already at this stage, teenagers, and you feel like, man, I wish I would have learned some of these things early on. I wish I would have branched out, created my village to encompass more than those just right in my inner circle. But the community resources that are out there, you still have the opportunity today. Again, I know we've spoken on humility, but to say to your child, hey, I don't think I've created this safe psychological space for us. And kids react so well, maybe not right to your face, right? But to humility that they see. And the best way that we can teach is by mirroring, right? Is by becoming a reflection of what we would like to see in them. And so it is never too late. It really is not, to go to your child and then to branch out and find resources for them. But yeah, the greatest thing, building that village, So thank y'all. I've really enjoyed this today.
Thank you, Riley. All right, Dr. Comanche. And before you start, Dr. Comanche, we did get one last question, and I don't want to leave it unanswered. So while you're providing your final thoughts, if you can incorporate, and I'll condense it down. The question we got was about providing effective counseling to teens, and those techniques that we're trying to help them with about negative consequences. How do you help a teen who's witnessing substance abuse and use in their home on the normal day-to-day activity? This person said that they've even had experienced families putting THC oils on babies. And so kids are growing up in a society where drug use is normal. So how do you work with teens where, every day they see that and feel like that this is normal behavior, to how to kind of educate them and show them that that really isn't normal behavior?
Thank you. I would say model, of course, being a professional, being a counselor, you bring certain things into a counseling setting. Like, of course, you have modalities that you're going to be using, whether it's CBT, motivational interviewing, or, whatever you're using during that process. But I would just simply say modeling positive behavior. If it was a male that I was counseling, a teenage young man who was, who was experiencing this kind of stuff at home, and once I work with him and try to see what his goals are, then I would be working with him to accomplish these things, to accomplish his goals, not necessarily paying as much attention to like what's going on within the family itself, right? But my focus would be the teenager and helping him achieve the goals that he want to achieve for his life. And how do I do that? I do that by I'm just going to be honest with you. I'm probably going to end up working with him outside of the normal counseling session. So it's going to be some mentoring. It's going to be some life coaching. It's going to be making sure that I model what a healthy male looks like in his life. right? As a female, if it were a young lady, then and this is just me personally, I don't counsel young girls, right? I don't do it. I let one of my female staff do that. And I try to put my clients with someone that they can model, because transference is going to take place. Transference and counter transference is going to take place. And so I like to put a client with a healthy therapist who I know will model that type of behavior, especially dealing with teenagers, who would model it when they're not getting it at home. And this is what we're talking about, when they're not getting it at home. So I would put them with someone, a counselor or a coach or a mentor, who can help model the type of behavior that they are designed for their life. It's nothing we can do, except, when that type of stuff is going on in the home. And we don't want to tear the home up by bringing law enforcement in and that kind of stuff, because you're going to make the matters worse. First, do no harm. So unless there's some abuse going on, you know what I mean? Do I have a duty to report? There's no abuse going on. I'm not going to send the police in there and say, well, I think their mom and dad is selling dope. We need to get the narcotic agents involved. I'm not going to do that. But we just have to model good behavior. That's all I can say, and work with them as best we can. There's nothing going to be more important than that teenager having an example of what a woman looks like or what a man looks like, modeling healthy behavior, attitudes, and stuff like that. You aren't going to be able to beat that when you model that type of behavior before their eyes, because that will give them something to say, you know what? When I grow up, that's what I want to look like. That's who I want to be like, because they need a healthy role model, right? So that's what I would say about that.
Okay, great.
Okay.
Thank you. Thank you. Thank you all so much for being with us today.
I have one more thing, Cara, because
Okay, go
I
ahead.
answered that question. There were 4 points that I wanted to give that we talked about before you asked me that question.
I'm
Right.
sorry. Go ahead.
The first, peers. What do we do in dealing with teenagers? I would say this: watch who they hang out with. I would keep your eyes on their peers. Right. Keep your eyes on the peers. Second thing, listen to understand and not respond. So when I'm listening to my children, I should be listening to understand rather than listening to react or respond. Encourage positive goal setting. And I learned this. This is something that I learned. I wanted to leave you with, Cara. This is why I interjected there, right? Children spell love. This is how they spell love. Time. They don't spell love by new Jordans, new games, new phones. They spell love Time. Spend time with them, right? And when they know love is present, they'll open up. That's what I wanted to leave you with. Thank you.
Yes, thank you.
All right.
Thank you so much to Dr. Bagley, Riley, Dr. Comanche. We really
Mhm.
appreciate you all. Thank you to the Foundation for Wellness. I just want to add before I turn it back over to Ashley, that if you all are not following Northeast Delta, please do so. We like to say follow the Phoenix. We are on Facebook, Instagram, and we also have a YouTube page to keep up with what's going on, any events and activities that we will be hosting. And also make sure that you keep up with Foundation for Wellness, because you never know when we will partner again to bring webinars like this to you. Thank you so much. Ashley, over to you.
Thanks, Kara. And as what Kara said, we do send surveys after this, and we ask y'all, what do you want to hear next? And Kara and her team look at those surveys. They look at what topics y'all are telling us. So please, at the very end of the survey, tell us what you want to hear next. We love partnering with Kara and her team, and we want to give you education that you guys want to hear and want to learn. Thank you so much for being here for 2025 webinar series, and we hope to see you at our next series with Northeast in maybe 2026. Thank you so much, everybody. Have a great day, y'all.